It's because my cohort, Gideon's not here. He's out of the state, but I have a special guest with me, and I'm going to introduce her. And tonight's topic is what's next in aesthetics in 2025. Now, there's so many things going on in the aesthetic world. It is just flipped. I mean, I think every year we see something new, and now with Korea leading the edge in a lot of the treatments, we're seeing so many new things coming down the pipeline that are really interesting and really fun. We see new trends in treatments. We see new procedures being done. We see new products being utilized. We see new assessment skills. So many different things. So I'm going to bring on a guest with me. Her name is Erin Barini, and Erin is a PA. She has over 20 years of experience in doing medical aesthetics. She is a a Galderma trainer, and has 2 clinics here in Southern California. So Erin has a lot of good inside information as far as new techniques, new treatments, things that are coming down the pipeline. Erin, welcome to the Aesthetic Immersion. Thank you.
Thank you, Lori. Happy to be here.
Thank you. I appreciate it so much. So we're going to get right down to it because we have so much to talk about. Erin and I were talking earlier and we're like, oh, we have so much to talk about. We kind of want to go into some new things that are coming out. One thing I want to mention to you folks out there, we have a little chat. So if you have questions for us, please type in questions or anything that you want. We'll see them pop up and we'll be able to kind of converse with you. We want this to be conversive. We want to be able to talk to you. So please get your questions in there and we will help to answer them. So I want to kind of start this off here, and I'm going to start this off with some new stuff coming down the pipeline. 2025, we have new toxins being FDA approved. We have 2 new toxins. We have one from the company called Galderma, which is something that's derived from what they call the Pearl technology. It is a new botulinum toxin type A. And when I say new, I mean all of the rest of the neuromodulators, all the brands, are from a certain strain of Clostridium botulinum, and that's the Hall strain. Galderma went out somewhere in the world, dug up some dirt, and they found a new strain of Clostridium botulinum toxin, and it is a different strain. So they have formulated the brand new toxin. We don't even have a name for it yet, but it's a brand new toxin that is actually liquid. It starts as a liquid and it stays a liquid. It's not something that's rehydrated. So it's going to be interesting to see how this might act a little bit differently. I don't know if Erin, if you're a Galderma trainer too, I don't know if you've heard too much about it, or do you know very much, have you heard much about it yet?
I haven't heard too much about it, but I am excited about it because
Yeah.
in the past, I would say 2 to 3 years, I have really seen a big increase in those who are not responding to Botox anymore.
Ah.
And so there's a big group of people. There's a Facebook thing that I have joined on discussions on what will be the alternative being gone through all of these other neurotoxins. So I'm excited to see if this has any effect on those who have actually not responded to Botox.
Yeah, that's interesting. I know a lot of people are trying like MyoBlock or botulinum toxin type B on some of those patients. And if they increase the dose high enough, they can get more longevity out of it, but it stings and it's expensive and you're giving thousands of units. So it's tough. I think this is still going to be a botulinum toxin type A. So if somebody's got neutralizing antibodies to that, it's something to try. I don't, it might be to that actual protein. So we'll see, see what happens. It won't hurt to try it. But yeah, if somebody has neutralizing antibodies, I know we got to wait for a couple of years to even try anything on them. So that makes it kind of difficult. But that's going to be interesting. It's going to come out in a liquid form. It's always going to be liquid. So people don't have to worry about reconstituting it, knowing how many units per tenth you're injecting. It's all going to be very consistent. So I see a lot of people not knowing how much they're injecting, how many units they're injecting all across the country. Erin, you train, you probably do too. And they chart 4 units and they're really giving 10. So they chart Botox units and they're giving Dysport. So it can be interesting. So I think this will maybe help with people being consistent in charting the right drug they're giving and the right amount of the drug they're giving. So it'll be kind of interesting. So what other new toxins coming out, Erin?
I mean, as far as toxins go, I don't have any information. There's so much all over the world.
Yeah.
But as far as things that are
Benev.
coming here that we're at liberty to say? I
Yeah.
don't
Yeah. Well, Benev,
I'll
you know,
leave that. Yes, with
yeah.
the Lativo. Okay.
Yeah.
Lipo.
Yeah. So Latibo's coming out, and
Mm.
Latibo's probably going to get FDA approved this year, you know, the 2025. So that is a new neuromodulator that's been used in Korea for a long time, and now it's coming out here, and Benev has the rights to that for about 3 years, I think. So we're going to see that on the market. Latibo is also a 900 kilodalton molecule, so it's the exact same weight as Jeuveau and Botox, and it's the Hall strain. So you're looking at the exact same stuff. So we'll see. You know, sometimes they have little subtle nuances that make them a little bit different, but you're looking at kind of the same idea. So it's always interesting to see what the subtle nuances are and the differences of these you know these same core proteins. So it'll be interesting to see. It's worth a try. Yeah, be fun.
I'm excited about that too. I don't know if it'll change our neurotoxin world, but it's
We'll see.
competition,
Yeah, I think it's you know what, a little competition isn't bad.
right?
Now it's there, but they're going to be the sixth horse to the race, and we know everybody asked for Botox. Why? Because it was the first horse to the race. Everybody recognizes it. It's like Kleenex. You know, everybody knows Kleenex, but then there's all kinds of brands of Kleenex. So it'll be interesting to see if this kind of lights a fire under some competitive pharmaceutical companies' butts, or we'll see.
Right.
We'll see how it goes. I don't know where the price point's going to be. My guess it'll be medium. It'll be probably in the middle, my guess. So they don't tip over any boats, they're make any enemies.
Right. I think they need to be competitive if they're going to do well.
I do too. I do too. It's just it's kind of like they're offering something that's the same, so why not make it a little bit less expensive for everybody?
Right.
It would be
Yep.
great. Please. So for fillers, do you know of any new fillers that are coming out at all? Are you appraised to anything
Well,
new?
you named a few
Yeah.
earlier, so I know there's some coming down the pipeline, and um I can't vouch for knowing what the new ones are for
Yeah,
filler.
there's not a whole, yeah, not a whole lot that we talked about a couple earlier, not a whole lot that we know too much about, but Evolus is going to be launching a new filler this year, I think, and it's under the name Evolysse. So I think there's a couple different names they're thinking about for that filler, but so look for Evolus. They're going to be launching some fillers, and that's a relatively newer filler. It's not been tried in Europe for years, like a lot of them are that finally get to the US. This is a company that made the same expression technology that Galderma has. So this is a company that made the same technology as Kiss, Contour, Define, and Refine. So it's that company. So we'll see how it behaves, what it looks like, how it behaves. I don't know the rheology yet. I was at the Evolus headquarters, but they couldn't share with me a rheology. They couldn't really share with
Yeah.
me much. So I don't know. They didn't have that data yet, apparently. So we'll see. Novaestiq is another company that is going to be bringing a filler to the market to the US, getting some approval for that. It is by a company called Chroma that's in Vienna, Austria. And I had the opportunity to go out there and tour that facility. It's impressive, very impressive. It's a very well-known company out in Europe with thousands and thousands and thousands of fillers, syringes done. And they're going to be bringing out about 2 new fillers first off. So I don't know the name of those, but guaranteed that they're going to start with end with IQ, like Magique, because Novaestiq is IQ. So I'm sure that they're going to have cute little names with that. So those are a
They need a
couple that are
natural word in there, like
right.
natural.
Naturalique.
Everybody's pushing for more natural.
I love it. That's true. That's so true. So those are a couple of like the toxins, the new fillers that are kind of coming down the pipe that you're going to kind of see. Some of the other trends, like Erin, people are kind of aware of. Are you getting questions about people wanting to dissolve fillers or concerned about what fillers are in their face? What are you seeing in your clinic?
I have. I mean, I think especially this coming year with the previous year being big on the overdone look,
Yeah.
too much filler, especially with how the heightened awareness of safety with injecting fillers has really gotten popular. I think people are really building awareness that filler can be a not good thing. So they want to stay natural. They want to remove the filler. And I'll tell you guys, it's really important. filler's important. It's a great product, right? But maybe
Mhm.
over the course of 5 years, if you've been doing it in this exact same spot, 5, 10 years later, you might want to consider starting to remove that. So I have seen an influx of people wanting their filler removed.
Yeah.
And what I have to do is sort of educate them, because they really don't know what they look like without it. And I think if filler is put in the appropriate place and managed by a good provider over a period of time, there should really never have to be this, I want Hylenex to take it out. But sometimes as we age, the skin falls, the fat pads go away, and that filler starts to kind of migrate in different places and they keep getting injected. I am seeing an influx of having to remove some of it and put it in back in different spots because of the way we're aging. Another thing I've been seeing a lot of, and I know this is probably popular countrywide, is the big craze with Ozempic and Manjaro and people losing weight. People are coming in to have to get certain things done, but they want to look natural. And that is
Yeah.
obviously the big word for the year, I think. And so I am leaning obviously more towards biostimulators with the Sculptra, and hyperdiluted Radiesse. I know we'll be doing a lot more of that. I do anticipate, with as much training as we do, I think that Galderma is going to have a really big influx of seeing more Sculptra being purchased, because a lot of the consumers they're getting scared of fillers and they're
Mhm.
wanting a natural look. So I think we have to be careful as providers just not to give a bad rap for fillers, because there's still a very good place for it. But that natural look is a big popular buzzword.
Yeah. I so agree. I think people are becoming more aware of bad filler. And I tell people, if you see it, it's not good work. If you see it, it's not good work. If you're like, oh God, I love her cheeks, you're like, they're too big then.
Right.
If you notice filler, it's not well done. So I think people are really they're starting to recognize poorly done filler. They're starting to recognize some of the things, some of the issues we've seen for years. But maybe social media is bringing that out, and I think that's a good thing. I think, too, I think one of the reasons that people are look like avatars and bowling balls and Cabbage Patch dolls, I think is two things. I think one is it's providers who don't understand three things. Don't understand someone's innate anatomy and respect their innate anatomy, their shape, their size, they didn't have big cheeks, don't give them big cheeks. The other thing is not understanding facial aging and not knowing what planes of tissue and what tissues descend and which tissues kind of help kind of disintegrate, not knowing that. And the other thing is just being greedy. I
Yeah.
think that we have providers who don't know the facial aging process and they just want some money. So then you've got a bowling ball or a Cabbage Patch face. And we see celebrities like that, which just baffles my mind that they have all the money in the world and they look horrible. Like, who are they
Right.
going to? So it's really surprising to me sometimes, and I think that scares our patients. I see that too. That people come in like, just dissolve it. I'm like, dissolve what? You look great. I'm not
Right.
dissolving anything.
Mhm.
So, I mean, you and I have had fillers for me 17, you at least 20 years, right? A couple years
Probably.
before
Yeah.
me.
Yeah.
And I've never had stuff dissolved.
Mm-mm.
I don't even know how many syringes of filler I have. I think I had
I
probably
know, right? I know.
finally, yeah, I probably had like 16 this last year. But I think that
And you know what, Lori, though, let's just say let's say the last 3 years, you've had 30 syringes in your face. I'm guessing it's always by Gideon, that by Dr.
yeah,
Kwok.
usually yeah.
Okay. That makes a big difference. If you have the same injector, seeing that patient, the chances of becoming overdone or overfilled or not looking right are a lot less. But you see these people, I'm in Orange County, and there's
Yeah.
med spas, there's dermatology, there's plastic surgeons. They're on every street corner. And these consumers go from one place to another, wanting the same thing done every time, not understanding the history that they've already had it done for 5 years. So we don't have control over that. But as
No.
providers, we want to be aware of it so that we can educate our patients, not to get
Yeah.
the puffy face or look disproportioned.
Yeah. And it does. It takes a little bit more time to educate them on, no, I'm not going to do that. You're going to look abnormal and here's why. Here's why. Here's where you need a chin. You don't need more cheeks. Or
Right.
I got to do your chin before I do your lips because your lips are going to walk in the room before your face does. So I think it's up to us to to number one, be knowledgeable in what we're doing and then explain that to the patient. That's what's so, so very important. And you make a good point where we have people who are spa hoppers. I see them all the time. They look at Instagram people and they're like, they'll tell me, oh, I went to Dr. K and I went to Dr. Rivkin and I went to this person and I went to Nicola and they'll tell me, and I'm like, spa hopper. So
Yes.
they're going to see me and go somewhere else after this because they're not staying with the same, either what they want to meet everybody on Instagram, or they're not staying with one provider. So you can have that continuity. I know what I did to you a few months ago. I know where you were. I have pictures of you before. What's so important is people forget what they looked like. Sabrina Fabi did the article on perception drift. People
Yes.
forget what they looked like. So whatever you do is their new normal. And they keep asking you for more. And it's up to us to go, no, no more. You're done. And
And
we'll just,
that's the part that you just said is no more, you're done. That sometimes drives them away. And that part for a provider can be discouraging. So they just meet the needs of what the patient is asking for, which is more filler in the same place. And
right?
so I don't think that creates a quality provider. If an injector is looking to be very good at what they do, they need to understand what the patient needs, hear what they're asking for, understand what they need, and be willing to educate, saying, we're going to take this out and start over. If that's the case, if it's their first time coming in, you need to trust me because we're going to make this look beautiful.
Yeah.
And when the provider gets through to them to do that, that is a big growth spurt, not for the provider, but for the patient too. And that is a long-term relationship built right there.
Yeah. And I think when you do that, you build trust. And when you either say no or you suggest something where like the patient might want nasolabials and you're like, no, you need mid-face first. We've got to do your mid-face. And they're like, what? And then you educate them and they're like, okay, I get that. And I think as we vet ourselves along the way and show them that we understand what we're doing and why we're doing what we're doing, that helps build that trust. So whether we need to dissolve or whether we need to put it in places they've never put it before. I see the temples ignored constantly. I think sometimes that's a good thing because maybe not everybody knows how to do temples. So I think there's a lot of adverse events that are probably not happening because people don't do temples, but leave it to those of us who do them all the time. But I see full faces in these I see peanut heads all the time. So it's up to people, it's up to us as providers to assess that. And if you're not comfortable doing something, send them over to somebody to do a procedure and then they can come back to you. You don't want to keep a hold of that patient or take anybody, but you just want them safe. That's the most important thing.
Right. And safety, it's fun being in the industry this long, finally seeing trends circle back around.
Yeah.
And I was just thinking about this today because, I do see a lot of weight loss patients. We're doing a lot of the peptides and they just can't be skinny enough. And I'm thinking back when what did they call it? I actually was discussing this with one of my patients and she called it the cocaine craze. Do you remember back? It was about 20 years ago, where I guess the thing to do, I've never used drugs, but cocaine made people skinny. And so it was part of the reason why they would use it. But the in trend was to be skin and bones, like really skinny. And that is what I've been seeing lately. These people are on these peptides and they can't be skinny enough. And it shows in their face. It shows in their chest. It shows in everywhere. And the trend is going to be that they're going to need they want to look natural, but we're going to have to restore that. So with all of our injections and lasers and
you bring about something important, and that is like with the GLP-1s that are so popular right now. You lose more lean body mass, i.e. muscle mass, than you do fat. So it's really not a good thing, and you shouldn't be on the GLP-1s unless you are on a program where you are exercising, getting your proteins, and probably meeting with somebody once every week or two, which with our clinics, Erin, you're in our family, we have 7 clinics, and we have a counselor that actually meets with them virtually every week and gives them education, because that's what's so important. You've got to get out there and exercise. You've got to get out there and weight lift. You've got to keep your lean body mass, or you're going to look like you're anorexic. You look unhealthy.
I'm seeing a lot of it.
Yeah.
It does look it's surprisingly.
Do you watch the Golden
not aware
Globes?
of What'd you say?
Did you watch the Golden Globes?
Oh, right. I know they can
Yeah.
barely walk. It's crazy.
It's they're like little sticks. It's really
Mhm.
not, it's not healthy. Yeah, it's not healthy. But
But I
I
do
think
see that
that's
being the trend this year for 2025. We're going to see it more and more of it. And I think for me personally, my moral compass is I'm going to educate them to correct that.
right.
And whether it's with biostimulators, but also, kind of going back on the peptides, newer thing that it's been out for a long time, but I think you're going to see this on the horizon as well, is a peptide called Somorelin.
Yeah.
And Somorelin isn't for weight loss, but what I use it in my clinic for is for those people who are at their weight loss goal. And I'm seeing a lot of people want to stay on the GLPs because they
Yeah.
like it. It curbed their craving. It's working, but then they're too skinny. So we're transitioning them to Somorelin because what that does is naturally boost your own human growth hormone.
Hmm.
Um,
Hmm.
and it will help maintain muscle mass. It also is an assistant for increasing fat metabolism, but it restores the youth of cells. And so we're calling it the anti-aging peptide. And you'll be seeing, I know that's going to be, this year will be a popular one.
I think this year's going to be huge for peptides. I think we're learning so much about regenerative medicine, and that's another big thing for 2025 is that regenerative, the health, the fix the inside also. One of my
Holistic
colleagues,
approach.
Kristen Hanian, who is in Florida, she's great at doing peptides. That's her thing. She does all the labs. She's phenomenally intelligent, and she will do peptides and monitor her patients. And I see some people doing that, but you can't just play with it. You really have to know how they really interconnect and work. People are going and getting, say, NAD infusions, right? Well, they don't know that NAD is only absorbed by cardiac and nerve muscle tissue. So getting an NAD infusion, no wonder you feel like crap when you get it because it's not absorbed where you need it absorbed. I think one of the best things to do is take supplements that will help you make your own NAD. Some people take NMN, nicotinium mononucleotide or something. Some people take that. I've gotten a product called Time Plus in my clinic, and it's on my Instagram if it's on a link, but it's called Time Plus. And this supplement, when you take it each day, it's like a vitamin. It helps you increase your NAD production by 243%. Crazy. And it's just like a vitamin.
Yep.
So I think the best thing is to help yourself. It really will help reverse biological aging. And they've done studies to show that this product does help reverse the biological clock, not the chronological clock, but the biological clock. So it's pretty darn cool. And I think that's where we're kind of headed. Are you seeing people that are asking you more about regenerative type medicine, like helping the inside?
Absolutely.
Yeah.
Holistic approach,
Yeah.
natural approach. These are the kind of things I'm hearing, which are a little, it's baffling. I love it because I've always been a very healthy, holistic type of person. But just seeing it kind of on come to the forefront in the consumer's eyes,
Yeah.
whereas they didn't care what they were getting done, they just wanted to look good. Now it's like, oh no, we want to be healthy, we want to live longer. Who is that guy? Is it Brian Johnson, the gentleman that's trying to like live forever? Have you heard of
Right?
this?
Yeah, I saw the commercial on Netflix the other night. I didn't watch it, but he's got the hair cap on. He takes
Yeah.
150 vitamins a day. He's got the green
He's
juice.
living just to live longer. He doesn't work. He doesn't like have a life. He just takes all these supplements and does. I love it. I'm like, well, I guess
I'll
if
have
I
to
had
watch it.
$1 million and
And I was independently wealthy, and I sold Venmo or whatever he did. Yeah,
yeah,
I think is that
do
interesting?
my
I'll have
research
to
study.
watch that. It's so interesting. But you know what? We do have. I mean, like it's funny because you look at the Bible and they used to live 400, 600 years.
Yeah.
So there's something that's happening here. And then we've got so much stuff in our environment. I mean, like, I'm not going to mention America because we got so much crap in our food and so many additives and GMO things that we have so many things that are causing problems in our health and shortening our life. What's good is I think people are starting to see that and they're starting to read labels. They're starting to go with organic or they're starting to go with, nope, I don't want that food coloring. It causes an issue. People are becoming more knowledgeable. And I love it, Erin, you said this, that they care more about their health overall. And I respect that. I really respect that, as opposed to people just oblivious, being oblivious and walking around and not knowing anything. I love that people are taking the initiative to learn about their own health and how they can be healthier in general. It's really a big topic for today, actually. It's a big topic in our country, which is kind of good. It's never, I don't think we've ever really had something
No.
this
And
huge in our
think
country.
I think due to social media, we're finally
Yeah,
building an educational platform. Sometimes it's not so
yeah,
good, but as far as learning, food is what makes up our body.
yeah,
So, they're
yes,
finally learning more about, the American culture versus Chinese culture or other cultures that they naturally live longer but don't do anything different, but it's the food they eat.
right, right.
What I do see though is it's a dichotomy. It's like they are interested in holistic and health, but they want the quick fix and now. And so we're still doing the body sculpting and the semaglutide and all these things without really putting the effort in the gym yet. We'll see it for this first month, right? Because everybody's on a New Year's kick.
Uh-huh.
Um, but I think that as far as exercise and really being the whole holistic approach is still not there yet. But what I am seeing in the clinic, the peptides, which are a good source, they
Hmm.
really are. Depending, there's a lot of peptides out there, but if you're looking at kind of the holistic approach, that's the way people are moving. The
Yeah.
other thing that our wellness coach does is the gut health, the probiotics, the prebiotics.
Yes.
And that's been around for a really long time. But I think in this next year, that is going to kind of explode as well.
Yeah.
People are interested in what's growing. They're learning that the gut is their second brain or their first brain, however you want to look at it.
Yes.
And, once you kind of understand that you have like a brain here and the gut is another brain, people want to know more about it. And I've seen patients see Sonia and come back to me with a completely different perception of life because they feel so much better. And
I
what's
love that.
funny is they spend more money with me because now they're ready. They're ready to go look healthy and be
Yeah.
healthy because they feel healthy.
Yeah. Yeah.
So it's that from the inside out kind of thing, as opposed to maybe the outside in.
I think it's brilliant, and we're learning more about that gut, the second brain. We're learning more about that, and it's so very interesting to see what the probiotics can do and how we can change things within our gut as far as absorption and flow in general. So I think it's all good stuff. It's
Yeah.
really good stuff. Somebody asked a question about what is the adjunct being used with GLP-1 or instead of GLP-1.
Are they
Are
referring to the Somorelin maybe?
I'm maybe is it like an appetite? Are you asking about an appetite suppressant type of thing or something that slows the gut down? I'm not sure. I don't know. Maybe clarify. I'm not sure.
I know in my practice, if they're talking about something in addition to the GLPs, we have used HCG, human chorionic gonadotropin,
Hmm.
and that's really good to kind of help detoxify the body. Sorry, that's my dog. Uh, detoxify the body and help assist in metabolism, speeding up the metabolism. I'm not sure if they're talking about in place of, oh, the Sermorelin.
Samorlin. Okay,
Yeah,
And Samorlin
Sermorelin.
helps you sleep too. It helps you sleep a little bit too. So that's Samorlin's a good one too. Yeah. Yeah. So that Samorlin helps to increase human growth hormone.
Right.
Yeah.
Which
Excellent.
is what we need
Um,
to restore all of our cells. So it's
right, right. We talked a little bit about people wanting to be natural. That's huge. That's huge. Not only natural in appearance, but they want more natural products. So, what are some of the, say, biostimulants, biologics? What are some of your favorites? You mentioned Sculptra. Yes, I think Sculptra is just, it was huge before, it kind of calmed down, and now it's taking off again. I think
mhm.
in the light of people wanting to be having a little bit more natural, have their own tissue grow basically. But what are some of the ones what are some of your favorites?
So just kind of to add on to the Sculptra, what I find really interesting, and for the providers that are listening, if you're not injecting a lot of Sculptra, you should get some more training on it because it will be coming down the pipeline now. Patients are going to start coming in asking for it. Whereas I've been injecting Sculptra since 2004, and that was pretty much when it kind of first launched. So I have a lot of experience with Sculptra, and it's, up until this last year, I would say it's hard to educate patients on biostimulators because they want that immediate gratification. They're familiar with fillers. Fillers were kind of first trained on. And now that everyone is into this natural look and have maybe heard of Sculptra once before, or say 3 years ago, I educated a patient on Sculptra. I personally think everybody needs Sculptra. And I love bantering with Dr. Kwok about Radiesse versus Sculptra, but they're both great biostimulators.
Yeah.
And but now I've had patients coming in asking for Sculptra, and that's new. That is new. I inject a lot of Sculptra, but it's because I make them do it.
Yeah.
And not because the patient's coming in to ask for it. But now I am hearing it. They're coming in asking for Sculptra.
I'm hearing that too, Erin. And I think people are hearing it on social media. Years ago, we didn't have social media. So now people are hearing about it on social media. They're seeing DTC advertising and realizing that it's natural. Now with Sculptra, a lot of people think that it lasts 2 years. Even providers that inject it think it lasts 2 years. I need to remind them that the studies only went out 2 years. So the studies were expensive to do. So the patients were still 80, 90% satisfied at 2 years. Keep in mind, Sculptra, hyperdilute Radiesse, it's a biostimulant. So you're growing someone's own tissue. So it's not that you're putting a filler in and expanding. You're not replacing volume. You are putting something in to stimulate the body to make collagen and elastin. And with Sculptra, you make a little bit of fat. So when you do that, that helps build your own tissue. Now, when you build your own tissue, you keep that for years. It's not gone in 2 years.
Take care of it, right?
It's not gone in 2 years. So just think about why. What is it doing? How is it working? And you'll know that, okay, that collagen and elastin's not gone in 2 years. It's still there for years. So just keep that in mind, that it lasts for a long time. One thing I'm really paying attention to now, and this is since Dr. Jackie Cortez did a hormone webinar with us. I'm learning how much the hormones play roles, and probably peptides too, in cell generation, cell regeneration. So I'm really paying attention to my older clients that are perimenopausal, postmenopausal. Are they on bioidenticals? Are they on hormone replacement? Because I know I'm going to get a better result with my biostimulator if their body is kind of working as it should, rather than deficit of hormones and peptides. So I think that's something we need to think about. Because in the years gone past, we've put a ton of products in people and nothing really happens. And we're like, wait, okay, they don't have the building blocks to make collagen. So we've got to make sure that they've got those building blocks.
Yep. Building from the inside out with the natural biostimulators is going to be really important for the biostimulator to do its job. So I think you hit the nail on the head too, talking about hormones. That's another one that I'm kind of seeing creep up now that there's more research completed about the cancer scare and things. I work closely with Dr. Gigi Kroll. She's a specialist in hormones in Newport Beach, and she and I have done some talks together. She's amazing because she has followed hormones. She's an OBGYN and now specializing in HRT. And we play around with it. We're concocting things with Sculptra and Estradiol and kind of coming up with some new combination therapies. But what we found for sure, doing Sculptra by itself and doing hormones by itself, and then you put them together and you do it together, produces by far a much better result.
Yeah. I think we need to make sure our patients have the building blocks to do what we need them to do.
Yeah.
So exactly. you can't put gas in a car that the gas tank is empty. The gas tank doesn't exist. You've got to have a gas tank in the car to put gas in the car, to make the engine run. So we've got to make sure that package is there. So I think it's something we really need to think about as we go along with our journey of helping with biostimulants with patients. Now with hyperdilute Radiesse, one thing that I think is I love, they've got Harmonica in Europe. And we don't have it here, but we certainly can mix 2 FDA-approved products together. And I love mixing hyperdilute Radiesse with a HA filler because we kind of have the best of both worlds. We got a little bit of volume, and then it stays there while you're building some collagen, and it's really really nice. It's called Harmonica in Europe, and I don't know if Allergan. I think Allergan might have it. I'm not sure, but it's a HA with a calcium hydroxylapatite, which is kind of a cool thing. So I do that with some of my patients, and I've had it done on me. And it's for people with skinny faces. At least you keep a little bit of volume while you're building collagen. So it's nice. That's a good idea too. Another thing that we have that is a biologic called Renuva. And Renuva is a adipose allograft matrix, and that is something that actually helps your body. It's kind of like if you think of fat as being like honeycomb, you've got honeycomb and you've got honey. You think of fat as being the honey. So if you take the honey out, you've just got the honeycomb. And think of that as the fat matrix. Think of the honey as the fat. So if you, from a cadaver, you take that fat matrix and you purify it down and sterilize it. And when you inject that matrix back into someone, their body will go, oh, here's honeycomb. I need to make honey. So it builds fat on that matrix. So it builds fat very nicely. I do find the results are very similar to like Sculptra or Hyperdiluted Radiesse, depending on the age. The younger people are, the better they stimulate, the more volume they're going to get. The older they are, the more sessions it takes and the more product it takes to get them where you want them to be. So age is huge with biostimulants. It's huge.
And going back to that, I see a question here that says, how do you combine HRT with Sculptra? And just to clarify too, and there's another one talking about hormones and building blocks for Sculptra. So I do want to address that because maybe it's not this FDA approved thing, right? But they do work in tangent with each other because you have, whether you're taking hormones orally, I personally am a big advocate. I read some research studies on estrogen. I recently had a hysterectomy, right? So it just motivated me to make sure I'm doing all the right things with hormones. And there was a research study that showed they took men and women, 10 of each decade of 70, 80, and 90 years old. And they took estradiol cream and they took and applied to their buttocks, right? I don't know if you've ever seen a 70, 80, or 90-year-old buttocks, but they're not firm. They're not perky. The skin has lost most of its integrity or elasticity, right? And they put them on them over a course of weeks, and they measured the elasticity and the quality of the skin every 2 weeks. And within 2 weeks, that estradiol had improved the integrity of the skin. So as far as a building block, or I guess I'm just going to share my own experience because I can't go dive deep into kind of breaking down the molecule, but I do know that we apply the estradiol first. I do a lot of it on the neck and the face for microneedling. So I will put the estradiol on, get the skin really healthy that way, and then I inject Sculptra underneath the skin. So they have found to be working hand in hand in the sense that, to Lori's point, it's really hard to build your own collagen if the cells in the skin of where the tissue needs to be reproduced, that collagen needs to be rejuvenated, is not healthy or balanced. And hormones do that for collagen.
So it's kind of like their building block. It's kind of like when you take, if you take collagen as a pill, it's not going to do anything. It's not going to go to your skin, really. Your body doesn't know where to put it. And even more than that, why take collagen? You need to take the amino acids that are the building blocks for collagen. But would they go to the skin? No, your body's going to take those amino acids and the peptides, and they're going to put them wherever your body needs them. So there's no guarantee of where something's going to go. So I kind of laugh when people are like, take this collagen, it helps your skin. I'm like, yeah, like your body knows where to put it. Awesome. Crazy. I love that. Good stuff. Good stuff, Erin. The other thing we're seeing too, and we only have like 13 minutes, is skin rejuvenation. So we are seeing so much with skin hydration, rejuvenation. Tell me some of the things that you're running across that people are asking for that you're seeing, and one of my favorites. What's new and upcoming? Yes,
my favorites. The polynucleotides, especially Rejuran, the salmon sperm. Right. I'm using that is growing exponentially with microneedling. So these boosters, the skin boosters like the Clardier, Rejuran. Those are two of my favorites, and using microneedling with that. And it's interesting because I used to only use that on younger populations. Like I kept that for my 20, 30, 40-year-olds.
Hmm.
And then when Rejuran came, and of course, that's from Korea, so their skin's always beautiful. I was actually scared, a little bit worried to do microneedling on aged skin because the Rejuran is a polynucleotide that
Hmm.
really helps restore the DNA of our cells. And so in my mind, I'm thinking we need to figure out how to use Rejuran on old skin. And so I've been playing around with it and found that actually in the past, if I did microneedling, say on really aged tether skin, it did not, that procedure did not serve the skin well. It had a hard time healing. It had a hard time producing collagen. And with the Rejuran, I'm actually able to accomplish some of that. So I'm huge. I love Rejuran right now. Um, I use it in different ways, but that is definitely something that I see, at least where I am.
Yeah.
We get the perks of Dr. Kwok bringing goodies and like trying new things, and I love that. Some work, some don't, but when I find one, it like skyrockets just because I see
Yeah.
the benefit from it.
We've seen in Europe the polynucleotides and the PDRN really, really having great results. They've done a ton of studies on that. None of them are approved to inject or put beneath the skin in the US. So just so you know, you cannot inject polynucleotides legally. We had somebody arrested and booked, a provider, about 6 months ago here in Southern California for doing that. So it's not illegal to inject it. But it's legal for topical placement. So we can put these exosomes, we can put the polynucleotides, the PDRN, the PDGF, all of that can go topically. PDGF, which is Alencia, can't remember the name of it. Anyway, ALL something. The
Yeah.
PDGF, which is platelet-derived growth factors, that is legal to inject. So you can inject that. That's been used for hair regrowth, skin rejuvenation, but those are platelet derived. So sometimes platelets have their limits a little bit, but those work very nicely for some of the hair regeneration. Somebody else had a Sculptra question, but I just missed it up there. Sorry. Microneedling, like you said, we
Oh,
use microneedling, radio
oh,
frequency
and they're asking, there
microneedling.
is a question that says, do you microneedle estradiol? No, you do not. You send it's a vaginal estradiol. You send them home with it. So they're to apply it at night on whatever. I've used it on necks, I've used it on chests, I've used it on butts, I've used it on the back of the elbows. Like it, you want them to use it where you're trying to improve the skin. So it's a local treatment.
Mhm.
So they do that at night, and then you microneedle it, whatever you're using during, at your treatment, and then you put the Sculptra underneath.
Yeah. Thank you, Maureen. Ariescence is PDGF. Thank you,
Oh, okay.
Maureen. I'm brain fart. I'm like, it's on my desk. I
You were
haven't tried it
close.
yet.
You
I
got
haven't
the
tried
first
it.
letter.
I'm like, A.
Yeah.
I haven't tried it yet, but yes. So we have so many different things that we can try. So I think in 2025, that's going to be huge. We have men's aesthetics. I wanted to bring up that a lot more men are coming in because they're more aware of how pretty their wives look and how young their wives look. But their men are really noticing, and it might be social media too, that wow, I need a better chin or a jawline, or they're kind of noticing things and realizing that we can tweak and have them look a little more handsome with just a small amount of fillers and such. So we're seeing more men, and I think we're going to see a trend of more men in
Absolutely. I think
aesthetics, which
it's
is good.
becoming socially more accepted because of
Yeah,
social media and the way everyone is staying young looking, except
I
for the men
agree.
who don't take care of themselves.
Yeah,
So
yeah. I agree. I think it's cool. What do you think of Profilo? I think Profilo is amazing. We can't inject it here in the United States, but I can't tell you that I don't have it in my drawer in my office. Profilo is an uncross-linked hyaluronic acid. It was developed in Italy, and they see that this really, really helps to build tissue and build collagen and really help to rejuvenate tissue. It's just injected, just subdermally in like 4 or 5 blebs, and I think it's awesome. It does take several sessions, so it's not a one and done. But I would love to see that FDA approved here in the United States, but we don't have it yet. Yeah. Easy Gel. What's my opinion
mm,
on Easy Gel? You know what? Here's PRP in my opinion. Aaron, do you still do PRP?
a little bit. I
Before I
still do
totally
have the
poo-poo it.
request for it. Yeah. I know.
I'm going to poo-poo it.
I'm not, yeah.
Yeah,
I'm not saying I love it. We just
we
have
did it years
requests
ago,
there.
right? We have better now. We have
Right.
exosomes. We
Right.
have PDGF. We have better stuff now. We have polynucleotides. Whenever we can inject those, it'd be even better. But we
Mhm.
have better stuff. So if you think about easy gel, and it's just thick PRP and PRF and all that good stuff. You're taking blood. It better be at least a 30 cc tube, or don't even do it. If you don't have a 5 to 6 time concentration, it's worthless. You may as well just draw their blood and slap it on their face. So when you do that, you're getting their own platelet-derived growth factors, right? You're getting their own platelet-rich plasma. Well, it depends on the age of that person and the health of that person as to the healthiness of the growth factors you're going to get from that. So it's very variable. When you get exosomes, or say umbilical sourced exosomes from age 0 mesenchymal cells, they are consistent, and you have something that is going to be a messenger to build tissue. So I think that PRP is something we used to use. They stopped using it in Europe years ago, and really gone over to more of the exosomes and some topical things to really generate a lot of good cellular regeneration and healing. So I think that's something that is definitely. I think people don't want to give up their spinners, their
Right.
centrifuges.
Well, and patients are just, they think
Yeah.
it's safer because it's their own blood or
Yeah.
whatever have you, but it's true.
You
Why go through all that when you have something sitting right there you can use without drawing
Yeah.
blood?
And it's used, people are promising something like volumization with it. You don't get volume with PRP. You don't get volume. You get growth factors that will help stimulate collagen and help give you a little bit of skin density. It might help with that depending on the concentration, but you're not going to get volume from PRP. If you get it from, say, Easy Gel or something, it's just thickened, it's temporary, but that's going to go away. It's not like a filler, so we can't treat it as a filler. And I think
Right.
it's sold a lot. It's natural. It's a natural filler. Well, it's not going to stay there for very long.
Mhm. I
Yeah.
will usually
Yeah.
use something like a PRP to sort of rejuvenate the tissue that I'm going
Mhm.
to inject with filler. So I'll use PRP, and then 4 weeks later, then I do the filler, because PRP and PRF, those things are going to help, again, the health of the cells a little bit, but it's not going to act as a filler, or at least
Yeah.
not as good as a
No.
filler. Yeah.
And keep in mind, PRP is very pro-inflammatory. You'll always swell a lot.
Yep.
Exosomes are actually de-inflammatory. So I'll put exosomes over a radiofrequency microneedling. I'll put them over a CO2 topically. It will reduce inflammation and redness tremendously. Love it. The exosomes I use, somebody's asking me, I use Elevai, Elevai. They are umbilical sourced exosomes. Yeah.
I use anti-age and also some Benev
Okay.
products too.
Yeah.
Also umbilical.
Excellent. Limelight is another one that is a good one that is umbilically sourced. That's a good one too. Yeah. Oh gosh, we have 5 minutes, girl. Okay, what
Mm.
else? Combination therapies. Erin, combination therapies are a big one that people don't want a bunch of downtime. Like, if you're going to do me, do it all at once or do
Right.
nothing. So tell me what you're seeing as far as people wanting to like go big or go home.
Well, gosh, I launched a procedure myself called Radiant Lift, and all it is hyperdiluted Radiesse and PDO threads. And I started out doing it like, okay, we're just going to do a little bit of the Radiesse first, then we'll do the threads, and or vice versa. And I'm getting all these, the patients just want it all done now.
Yeah.
They want that look. They don't have time. They have 1 week to do it all at once. And so the combination of PDO threads and something like a Radiesse, which is what I usually use with it. I'll sometimes use Sculptra or regular HA, but doing it all at once is a lot of fun.
Yeah.
That's been growing in my practice. I know that for the general public, probably it's not that popular, but combination therapies, you're seeing the big trend with. Didn't Ulthera just launch a new handpiece? I hate to say it, I'm not a huge Ulthera
I'm not either.
fan.
I'm not either.
But I will say the infrareds, the ultrasounds, the radio frequencies are being, they're going to start really, I think, tooting their own horn with tissue tightening with the Ozempic stuff, because of all the weight loss. And we can combine that with the biostimulators.
Yeah. Yeah. I agree. I agree. I think it's terrific. We sometimes we will do threads, Sculptra, and biostimulators at the same time. We'll kind of put in fillers, and it's common. Like even Galderma teaches, you can do filler and Sculptra on the same day.
Mhm.
You can do them on the same day. You're doing them in two.
Absolutely.
Keep in mind, you guys, like if you want to do Sculptra or hyperdilute radius or whatever, like a biostimulant, and then you want to do radiofrequency microneedling, you're in two different planes of tissue. Your biostimulants down here, and you're microneedling in the dermis, so it's not even anywhere near where you're injecting. It's nowhere near filler, because in the dermis, you're no deeper than 1.5 millimeters usually when you're doing microneedling or radiofrequency microneedling. So you can do those the same day. Perfectly
Mhm.
fine to do that. Yeah.
Yep.
Love
Yep.
it.
Might
Love it.
have
Love it.
tiny more swelling, but I love I love being able to do as much as I can in one treatment.
And you know what?
Not
Like
too much, but just addressing all the different layers at once, I should say. And that's a good way
yes.
to look at it. So
And you know what? They're going to walk away and go and be like, they're going to go, I love this. I love this. And you're like, it's going to settle. Don't worry, it's going to settle.
right.
But it's something that they can walk away. And like I tell them, like if you're going to be jacked up, do it all at once. If
Yep.
you're going to have bruising, if you don't have swelling, just do it all at once. You're done. So most of the things are in different layers, and we can really do those on the same visit if they want to kind of do that and have, a little bit of bruising or downtime at this, just get that out of the way, and you're golden. You're golden.
Yep.
So yeah, it's
I
awesome.
love the resurfacing too with whatever injectables, they need. And usually it's a biostimulator, but we have a photofractional CO2 and then I have a fully ablative CO2. And if we can do all that at once and then use the exosomes for healing time,
Love
beautiful
it.
treatment.
Love it. Yeah, somebody said I did my own split face after CO2 with plated exosomes and elastin nectar and got a much better. Oh, were you following me? Were you copying me? Because I did the same thing. Yeah, with plated and with elastin. My elastin side was much more calm. I was very surprised. It looks like I was very surprised that my plated side was much more irritated. I did not expect that. I expected it to heal quicker. Didn't expect that. So it's interesting. We learn something all the time, and I think those of us at the aesthetic specialty, we're our own guinea pigs. We just were like, I'll try it. Let me try it.
Right.
Let me
That's
see.
how you become a good provider, in my
That's
opinion. If you haven't tried it, then you
right.
you can vouch for it a
Yep.
lot easier,
Yep.
good or bad.
Yep. And someone's asking if, yeah, right. You expected the same thing, huh, Victoria? Yeah. If lasers are still in vogue, yes, lasers are still in vogue.
You know what? If
Absolutely.
you guys do not have a laser in your practice for this next year, I'm telling you, with how
Yeah.
the filler trend is going, you're going to see a drop in the desire to be injected with fillers. And of course, it's your job to educate and keep that patient retention, but it's a lot easier to do it when you have an alternative treatment, like some sort of either skin,
Yeah.
like I said, skin tightening is going to be huge this year because of all the weight loss craze.
Yeah.
And so I strongly encourage you, if you don't have a skin tightening, some form of technology for skin tightening, you better get one.
I love it. It's so true. Well, we're out of time, Erin, but we talked about a lot of
Man.
really,
Yeah.
really good stuff. Thank you so much for joining us.
It was
Thank
my
you so
pleasure to
much.
be here. So
You're
good to see
awesome.
you. I miss you, Lori.
I miss you too. Good information. Good
Yeah.
information, girl. Thank you so much. I appreciate it.
Thank you.
Okay, say bye to Erin,
Yeah.
everybody. Bye, Erin.
Bye, everyone.
Okay, you guys, I have just a couple little things I want to mention. We are going to be having, actually, we talked about plated, so we're going to be having plated here on February 4th. It's going to be AI Live next month, and we're going to have plated here talking about the platelet-derived exosomes. And because they saw my Instagram post, and I was swollen on one side and not. So they're going to kind of explain maybe why those results happened or not, and kind of where the best use is for platelet-derived exosomes. So that's going to be interesting. This AI Live is going to be on YouTube and within a week or two, so you can always catch it on YouTube. It'll also be on our podcast, so it'll be on both Apple and Spotify. So if you have any questions for us, just contact us at learn@theaestheticimmersion.com. Thank you for joining the Aesthetic Immersion. I appreciate it, and I will see you next month.